Morning. Thank you for joining this channel. There is a solution for healthcare. Yes, there is a solution. I would like you guys to read a book by Ron Bachman, Unlocking the Secrets of Health Insurance Premium. Folks, I'm a doctor, I'm a physician, I've been in healthcare for a long time. I've, don't take me wrong, I've done well. I used to have my own outpatient facility and practice urology for years. I know what healthcare is all about. After reading the book of Ron Bachman, Unlocking the Secrets of Health Insurance Premium, I've come to a conclusion. There is a solution. There is a solution under the umbrella of public-private partnership. We don't need no government, nobody. If you empower the consumers, they can take care of themselves. It's not a government solution, folks. This gentleman, Ron Bachman, has been an actuarial for 50 years. He has been in front of the Congress. He has given lots of speeches. And also, I've spoken to him a few times. I admire him. We have this Medicare supplemental because of him. He's the one who introduced Medicare supplemental, which makes sense. We can do more than that. Okay, coming back to the healthcare solution. Folks, under the public-private partnership, we can form a health review authority. Health review authority's goal is to supervise the insurers, so-called insurance companies. When an applicant applies for an insurance, if he gets denied, automatically they gets reviewed. Reason for the refusal of giving insurance is reviewed, and if the applicant is eligible for health coverage, which insurers don't want to give, they can get a certificate of guaranteed coverage under the health review authority. And it is almost like having a private insurance, folks. Especially my focus is on people who can't take care of themselves, who are economically impaired, physically impaired. These are the folks we need help. You know what percentage of the population do really need help? Believe it or not, folks, it's only 2 to 3%. You mean to say America cannot take care of the 2 to 3% of the folks? And the rest of the folks, they can take care of themselves if you give them the proper tools. Proper tools are, if you are a person, individual, self-employed, you make sure that it's like having a driver's license. You make sure that individual gets the health insurance. Because if he doesn't get health insurance, first of all, the gentleman who thinks that he's wasting money buying health insurance, they're wrong. They need to be educated. But on the top of it, government can say you have to have a health insurance, yes, and lower the premium by having a deductible health premium and health savings account. That is putting money aside into the health savings is a money maker, man. I think these folks need to be educated, especially people who would want to get health insurance. In any case, the people who are working for small businesses, these are the folks have no health insurance right now, because under companies with under 50 employees, they have no policy. Obamacare has failed because it took away the freedom of seeing a physician. Rather than, you can see a doctor, you can go to any place, you can go to any clinic. That has never happened. Under the small business, like a small groups, can come together and form a larger group and compete with the larger employer groups, folks. It can be done. All small employee group associations, and they can form a group and they can compete with large employer groups, and employers can lower their health premium by obtaining a health insurance which is deductible, and it makes sense. It does make sense to buy a lower with a lower health premium, and make sure the insurance companies, they abide by risk segmentation, having like well category, at risk category, chronic illness, and catastrophic. Chronic illness is only 15% of the US population, and their claims are whopping 50%. There's something has got to be done, but you cannot punish the rest of the folks who don't have illness. If they're healthy, their premiums should be under $100, folks. You can't go wrong with that. You have to have a premium, health insurance premium under $100. Yes, that's the way to go, folks. And the larger employer groups under the ERISA law. I have read this book from Ron Bachman. ERISA law mandates them to get health insurance coverage for all these employees. Larger employer groups are self-insured, obviously. They can be self-insured. They can also, under this Ron Bachman's rule, they can make lots of money. Employers and employees alike, they can make lots of money. I would rather encourage the larger employer groups to participate in the health insurance premium, which can be lowered, and it's a win-win solution for both employers and employees alike. That's the thing, folks. You have to have health insurance for all Americans. These 27 million uninsured, there's a reason. Most of the people think they're wasting their money by having a health. They're wasting money. That's not true, folks. They all need education. Let's come together and solve the problem. I give a credit to Ron Bachman. I would love to meet him one of these days and get to interact with him. And there is a solution, folks. Let's do it. Follow me. I'm not an actuarial, I'm a doctor, but I follow him. You can listen to his talk shows, Healthcare Insight, and check it out. Thanks again. Thank you for listening. This is Consumers Doctor, Dr. Bengal. Goodbye.